Great. So we will be talking about Germany's expanding role in global health. And of course, I'm using COVID-19 as a case example, which is quite obvious. We are talking about a little bit about myself, and I will also introduce you to Stiftung Wissenschaft und Politik, Institute for International Security Affairs. We talk about elements of the German global health policy, COVID-19 and Germany's international engagement, and I hope to have an open conversation with you. So SWP, Stiftung Wissenschaft und Politik, this is our nice entrance here in Berlin. We are a think tank and one of the biggest think tanks in Germany, and we cover international politics and policy and all topics in the wide field of foreign and security policy. We advise with our own research the German government and the Deutschen Bundestag, and also other multilateral institutions like the EU, NATO, and the United Nations, in my case, WHO. Yeah, I think I said that already. How do we do it? We do our own research that we put then in publications and studies, policy briefs that are all accessible via our homepage. You can find here or just Google SWP, and also oral formats that are exclusively for and invite only for policymakers. So I spend right now my day with observation, research, talking to people, and organizing policy dialogues and roundtables to bring together researchers and policymakers in the field of global health. And of course, media and public relations. For example, yesterday I talked to SWR2, it's a radio station, about the global distribution of COVID-19 vaccine. This is our homepage with one of my latest publication here in the front, so you can see and access everything we write, for example, here. I think Albrecht already said the big points of my CV, so I don't repeat that. But if you have any questions also on my CV or career path in Germany or in global health in general, feel free to ask later. So our working definition, what we use at SWP when it comes to health and global health is this one: health is a human right, global public good, condition for and impact of security, stability, and prosperity. So a little bit a different angle from what is usually understood as health, as not only the absence of disease. We look at health more from a political science, political point of view. I brought here the German attitudes to international policy. So what do Germans think of what's important to the world? What should policymakers prioritize? And as like someone working in the policy field, these kind of surveys are important because this is what Germany wants, and policymakers do listen to these surveys. So, and you can see here the bigger numbers, percentages is this the last year, and the smaller the year 2019. And we can see global health crisis is a new topic in this survey, so it was not asked for it, and it's on the second year. So it's global health crisis is a new topic, a newer topic, and a new threat that people recognize, of course, driven by COVID-19. I put here some captures from research and media on Germany's expanding role in global health. That we can see, I would say 10 years, since 10 years, we have media and research coverage like this. Deutschlands Aufstieg zur Gesundheitsmacht. So Germany is getting more power in this field. Germany's expanding role in global health from Ilona Kickbusch, a very nice, I think Albrecht, you also co-authored this one. I can really recommend reading it. What explains Germany's new role in global health. So something is going on here, something is new, something is expanding. There's a vacuum and Germany is going into it. And we will look at this a little bit further. What are the determinants of Germany's global health policy, where it is coming from? First of all, it's the post-Second World War narrative and as a guiding principle. So economic growth and social protection we can also find it in Germany's global health policy. It's more like the general foreign policy narrative. Germany is a big supporter of multilateralism and rights and rule-based foreign policy. We will find the right to human health, the human right to health, basically in every official document in the first or second paragraphs. It's very common to use these narratives. And of course, integration into European and global agendas. On the right-hand side, you see the SDGs, the 17 Sustainable Development Goals, which of course is a reference point for Germany's global health policy in the last years. This here is from a publication some years ago that I published with a colleague from Robert Koch Institute, where we looked at the German government actors. So this has changed a little bit, but I think it's still valid. Of course, we have the German Chancellery and Angela Merkel and the whole Chancellery that play a huge part in agenda setting. Maybe you remember Angela Merkel at the last G7 or G20 presidencies here in Germany, where Angela Merkel used this fora for the very first time also for health topics driven by the Ebola outbreak in West Africa. But of course, also other ministries. The leading part in Germany's global health policy has the Ministry of Health, Bundesgesundheitsministerium. So everything is basically coordinated there and also decided there. But of course, other ministries, the Ministry of Economic Cooperation and Development plays a huge part because this is where the money is. The official development assistance money comes from there. But other ministries, for example, the Foreign Office, gain more and more interest and attention when it comes to global health, also driven by infectious disease outbreak like Ebola and COVID-19. Yeah, this is just, if you want to read more, let me know. I can send you this publication or you find it online. It's not only the government, it's also the German parliament who plays a more engaging role in global health. I think 2 years ago, the Committee on Health created this all-party subcommittee on global health. So it's a committee beneath the Health Committee in the German Bundestag, advising and preparing decisions, not really making decisions, but preparing decisions for the Health Committee in the German Bundestag. I think 9 parliamentarians are in this committee from all parties. And of course, it's not only state actors, also non-state actors, for example, civil society actors, just to mention a few here, there are way more. Of course, MSF, Deutsche Allianz für Klimawandel und Gesundheit, KLUG, Venro as an umbrella organization for many NGOs. But also, of course, it's not only the actors here in Germany that are relevant and influence German health policy making, also other states. The US, for example, Joe Biden announced today that they remain in the WHO, which is a great news also for Germany. International organizations, WHO, World Bank, other UN institutions, international partnerships. You may have heard a lot about CEPI and Gavi in the recent months and weeks when it comes to vaccine and therapeutics for COVID-19. And of course, more and more attention and also power for philanthropic organizations like the Bill and Melinda Gates Foundation's Wellcome Trust here in Germany. They opened both offices here in Germany, and also German foundations who will work more and more on global health topics. I put here some characteristics of German or global health policy making in general. I think it's the manifested illusion that there are borders between health here and health somewhere else, and global health in general. There are no borders, which is the pandemic right now is the best example. The borders are just in the head, not in real life. Global health policy, global health governance is a highly emotionalized policy field because it's so close to life and death decisions. We have never seen Angela Merkel this emotional ever, I would say. but when it comes to health policy and global health policy, even she is. Central policy fields in Germany here is health system strengthening and the right to health, and health emergencies such as health crisis and infectious disease outbreaks right now. And also, which is very German, health protection, so social security, social protection, health insurances, very German topic when it comes to other. I see a question here, or a Kommentaranfrage. Yeah, please, why not? Nicola.
Maybe Nicola unmute, yeah, if you want to talk.
Otherwise, keep the questions and we come back to it later. Where was I? Fragmentation and polycentricity. The field of global health, also in Germany, has a lot of actors. And sometimes when you look into it, you find it quite messy and chaotic. There is some kind of structure, but it's quite difficult to find it. And of course, this also means that there are a lot of different budgets. That's like every ministry has their own budget. There is no real harmonization. And of course, also, and this is what's meant with polycentricity, the power and the interests are also distributed. Of course, as I said, the Ministry of Health is the coordinating body, but also the money lies somewhere else. So there are different interests and different agenda settings going on. And we also can see an expectation perception gap, I call it here. We have high international expectations from Germany. Like Germany is getting the new leader in global health. A lot of talk about leadership. At the same time, when I ask here German policymakers in global health, they have quite moderate ambitions. It's like, no, we like partnership. We don't like leadership. We do it together with others. And maybe we are not so good in what we're doing. So we've seen here discrepancy between what's expected from others and what German government is willing to do. Which is also, I find this quite, because that's why I screenshotted it, quite amazing. Maybe you remember the talk Angela Merkel gave some weeks ago in the German Bundestag, and this is what Dr. Tedros, the general director of WHO, said about it. He called it leadership, and he also said she is simply amazing. So this is new. Germany is getting a leadership role here from the father of global health. And but at the same time, no German politician or German government official would say we have a leadership role. I bring now to you, I think, 3 slides with some numbers. ODA stands for Official Development Assistance for Health. So what Germany's budget for global health, for supporting health somewhere else. You can see here in yellowish, the funding for bilateral ODA, so money that goes into partner countries directly. The blue channel is the multilateral, so what we give to other organizations like WHO, the Global Fund, Gavi, we'll see it in the next slide as well. What we can see here that we have a tendency for spending more. And we also see that bilateral and multilateral is almost 50-50, which is unusual because other countries, for example, the US, have 20% multilateral and 80% bilateral. So Germany is kind of trying to hold a balance here. What we can't see here is that official development for health is not only spent somewhere else, but also a little bit here in Germany. For example, 2015 and since 2015, health, like the budget on health for refugees here in Germany is also counting in this budget. So you have to really look at the numbers when you analyze this. Now we are zooming into the blue Balken, I don't know the English word, sorry, here. So we look only at multilateral channels. Where is it going, the money? Who is getting Germany's multilateral funds? So we see here that the yellowish part are PPPs, public-private partnerships. For example, the Global Fund in the fight against malaria, tuberculosis, and AIDS, Gavi, the Vaccine Alliance, or CEPI, the Coalition for Epidemic Preparedness Innovation, I think is the long form. So the money is not going, the most money is not going to the United Nations organizations, but to public-private partnerships, which is interesting also to see where the money is going. And you also can see the funds for WHO. Everybody right now is talking about increasing the funds for WHO, and you see Germany has increased the funds in the last years, but as we can see in the next slide, it's not nearly there where we have to go. These are the goal of spending ODA. The WHO goal here is 0.1% for BNA. This is like where we have to go. And you can also see the G7 average here. Germany would have to almost triple its contribution to get where it has to be, which is difficult. You now maybe ask, why is United Kingdom and Norway always there and over it? Because they put it in national law. They have to spend it. Germany doesn't have a law on this, so policymakers, parliamentarians can decide from budget to budget how much they spend. I brought here some highlights of Germany's expanding role in global health. Germany developed a first concept strategy on global health in 2013, right before the Ebola crisis in West Africa. A couple of months before that, it was launched in the German Bundestag. This concept notes, which is interesting to read, hasn't been developed because Germany really wanted to, but because other state actors, for example, Sweden, Switzerland, the UK, had such strategies and were pressuring Germany to also develop one. So countries are in kind of a competition also in this policy field as in all other policy fields as well. 2015 then, Angela Merkel developed a 6-point plan in a press release in response to Ebola. For example, sending equipment and also money and also people with expertise from the German institution in this field to help and support them. And this 6-point plan was very concrete, so it was very easy for government officials to follow on this one. Then, as I said it already, 2016 and 2017, the presidencies of the G7 and G20, where Angela Merkel put health as a first president on these agendas. And also in 2017, this is where I started my job at SWP, had the very first simulation of a disease outbreak with all the heads of states from the G7. So they basically simulated and played a pandemic and what countries needs to do. Very first time. Fire brigades practice all the time. Heads of states practice for the very first time here, simulated a disease outbreak. Then 2018, the coalition agreement between SPD, Social Democrats, and CDU, CSU faction, which is important because in this coalition agreement, there are a paragraph that says Germany wants to develop a new global health strategy. So the first one here from 2017 has reached its due date. So the government should develop a new one. Then 2018, Germany initiated a global action plan to achieve the Sustainable Development Goal 3, which is for health, which is a great achievement, I would say, in the international field, and Germany is well recognized for it. Maybe we can talk about this a little bit later. Last year, Germany had the presidency of the Council of the European Union, and also because of Corona, of course, put health and Corona there on the agenda. And last year in October, developed and launched a new global health strategy, and we will now zoom into it a little bit. So the new strategy, what are the priorities? Sorry, I need a sip of water. Promote health and disease prevention. This is basically what it says. It's very broad, and I would say everything that didn't fit somewhere else, they put there. Maybe you want to read it. It's not very clear what they mean, because promote health and disease prevention is everything and nothing. The next one, which is a new priority for Germany, take action to reduce the health impacts of climate change. So the nexus climate change and health is of course a thing, but it was not mentioned as a strategic priority for Germany's global health policy or climate policy, depending on the angle you look at it. Strengthening health systems and facilitate the provision of universal health coverage without discrimination. Health system strengthening is the German narrative, as I said before. Nothing new, but very important that it's there. The next one is more the health security, health emergency priority, health security, international infectious disease control, basically, and also biosecurity. And the last one, foster global health research and innovation. So these are more the thematic topics Germany wants to do. Maybe you think now, whoa, it's great, but there's a lot missing. For example, migration and health, or health workforce, and maybe, of course, a lot more. So Germany set priorities here, and of course, they could have been different. Some strategic objectives also in there. As I said, the German narrative in foreign policy making is partnership, not leadership. So doing partnerships with other international bodies, for example, and especially WHO. And this is also new, expand regional partnerships. So Germany is asking and using the European Union, or is working together with the African Union, for example, which is a kind of new field for German's global policy making. And of course, policy coherence. So the harmonization of the different actors, state actors in Germany, to have a consultation mechanisms within the German federal government. So Ressortkreisbesprechungen, for example, it's called. Of course, involvement of non-state actors, the ones I showed you before. Internationalization of German institutions, how international is Robert Koch Institute or universities, for example. Secondments of German expert and young professionals. So people working in German institutions who are sent to, for example, WHO for a short amount of time, like a year, for example, and then come back. And this knowledge exchange is what Germany is looking for here. Making funds available. They didn't put a number there, but they said they spent something on it. And what is also new, which is kind of good best practice, but it's new for this kind of strategy, is having a review process. The whole strategy is developed for a period of 10 years. And after 5 years, they want to look at their progress. So let's talk a little bit about COVID-19 and how did we get there and where are we now? I'm just giving we could talk like years over this, but I just give you a sneak peek. So we have this report here from the Global Preparedness Monitoring Board, which are experts in the field of infectious diseases, prevention and control, who said in 2019, right before the pandemic, the world is at acute risk for devastating regional or global disease epidemics or pandemics that not only cause loss of life, but upend economic and create social chaos. This is the warning. We cannot say that there were no warnings. The Global Preparedness Monitoring Board is the body to make these kind of warnings. So we knew that something like COVID is coming, we just didn't know when exactly. This is also from the survey from the Körber Stiftung I showed you before, German worldviews in times of COVID-19. You see here also the differences between 2019 and 2020. And you see, should Germany cooperate with other nations to solve global challenges? Big agreement from the German, or bigger agreement from the German people. But you see also that this is reduced in 2020. And also the other question, which is very interesting in light of the vaccine distribution globally, should Germany cooperate with other nations to solve global challenges, even if this implies initially putting national interest in second place? So, and a national interest is vaccinating the German people first. And I find this also, it's still an agreement, but we can also hear the tendency of reduction. I am asked a lot of times when I first recognize COVID or something is happening, a new infectious disease outbreak is happening. And I can't really say, I only knew that it was around New Year's 2019. And I first read it on Twitter, like more and more people tweeting about there is something going on, like other infectious disease experts I follow in this field. But this one here is a press note from DPA, Deutsche Presseagentur. And it's like, you see the date of their New Year's of 2019. Then the whole January last year, there was a big debate if this new outbreak, nobody really knew, is a public health emergency of international concern. So I don't know if you have talked about the World Health Organization and its instruments. It's basically the loudest alarm bell the WHO has when it comes to outbreaks. And there is legal criteria that has to be, like the boxes that have to be ticked until WHO can say it's a public health emergency of international concern. So on the 30th of January last year, the WHO declared COVID-19, which didn't have the name there yet, as a public health emergency of international concern. I think 2 months later called it a pandemic, which is not legally important, but of course for the media, for the people important, the pandemic is easier to understand. So I now present my observation analysis on the course of the pandemic in 4 phases. First one, paralysis. Nothing happened here in Berlin. All the ministries were busy doing their work, their usual work. Nothing really happened. All the alarm bells and the warnings from health people were not really heard of. Maybe you remember the small success we had in Bavaria in containing the first clusters there, which I think were very important for Germany's public health response, but also a little bit overrated. So we felt safe because we contained it there. When I talk to policymakers, he's like, yeah, the Bavarians, they can handle it. But I think health people knew that this is like basically everywhere right now. And also the German ministries were very busy protecting its people. So the Foreign Office, for example, was super busy with getting all the travelers back to Germany, or with giving laptops to all the government officials and putting them into home office, which is like a super big task for them. And this keeps them super busy. So when I said, okay, let's maybe talk about WHO and what we can do, they were like, no, we can't. We have to, like, I don't have a laptop. I sit at home and don't have access to the servers at Foreign Office. So this is what I meant with paralysis. The next phase is introversion. So it's like looking only for oneself. February until April 2020, which lead to this, maybe you heard about it, this mask diplomacy. Italy asked other European countries for help when it needed masks and other medical equipment, and all the other European countries said, no, we only have to look for ourselves, we forgot completely about the European Union. And of course, this is something the Chinese government loves to do and helps other countries indeed. And of course, for me, it was like, I knew that this is really serious when within Germany we had like proper border restrictions and border closures. For me, it was like, okay, this is now next level when European member states installed them. Next one is since late April last year, a German and European awakening. So at this point, the people usually working in global health or international policy were able to adapt to this new situation. And we had big conferences on the coronavirus global response and collecting money for the development of therapeutics, vaccine and test material. And of course, and always the German Ministry for Development and Economic Cooperation, as the first ministry in Germany, came up with their Corona Sofort program, like the emergency program for Corona and their partner countries. The last phase, and I think we are still in it, but maybe let's discuss this, is global action and old patterns. And I have some more slides on this one. One is the big narrative when it comes to medical products, especially vaccines. The German President Steinmeier and also Angela Merkel and also Ursula von der Leyen at EU level called the vaccine a global public good, which is not a new narrative in global health theory, but a new narrative in the public. A global public good is a good that should be accessible for everybody, independently from how much money they earn. So basically, everybody should have access to this. And it was the vaccine was declared as this very, very early in the pandemic. Then we see new old multi-stakeholder partnerships. I'm sure all of you have heard about the ACT Accelerator and COVAX as the multi-stakeholder platform for the development and distribution of a COVID-19 vaccine. This is, of course, a new partnership, but with the old stakeholders and also old way of working. We don't see a fundamental change in the way we work or regulate intellectual property rights, for example. It's the old way of doing things in a little bit of new formats. And of course, global action and old patterns, we can see here some countries, which is maybe not so old patterns because we didn't expect the United Kingdom, United States, maybe even Germany to perform that badly when it comes to COVID-19 cases. Maybe we can talk about this a little bit later when it comes to infrastructure and political leadership in these countries. And of course, global action and old patterns we can see here, which is a graph from The Economist, I think 2 or 3 weeks ago, which countries will get access to coronavirus earlier than others. The high income countries basically reserved all the vaccines very early in the beginning. The German government did the contracts with the pharmaceutical industries last March, so super early in the pandemic. Everything was basically set, and the global distribution of a vaccine and other medical products is not really happening because high income countries basically buy everything. But I'm sure we talk about this later as well. So where are we now? And I think this is something I would want to talk about with you. Maybe some open questions, and we are going into the discussion after this. How do high-income countries such as Germany justify their international activities or the lack of it in their response to COVID-19 and also, of course, other health topics? It's not only COVID-19. Are there policies or narratives that are being neglected? For example, everybody right now is talking about COVID-19. We are not so much talking about the right to health or resilient health systems, for example. What are the short and long-term geopolitical implications of the European response to COVID-19? I talked a little bit about the Chinese health diplomacy and opportunities there. Why is the response rather linked to question of capacities? How many masks do we have? Do we have enough ICU beds? Rather than a question of strategy. This is changing right now a little bit. Maybe you have read about the no or zero COVID push from researchers. I'm involved in this also, so maybe we can talk about this as well. And I think the big questions in the long run is COVID-19 an amplifier of crisis, or is COVID-19 maybe also a game changer? Right now, we have a discussion going on health equity and decolonization, also in Germany. And we talk about global justice and distribution of wealth when it comes to the vaccine. The problem, I think, a little bit is that Germany is in an election year now, and even the Social Democrats are not really going the international justice way, which I would like to see. But I think we can see also a little bit of opportunities because we have a discussion here going on. I think that's it for now, and I'm looking forward to your ideas, questions, comments, critique, whatever. Thank you.